Thank you. I now recognize Work and Welfare Ranking Member Davis for questions.
Thank you, Mr. Chairman. Ms. Gruninger, let me ask you, my Ways and Means colleague, Mr. Fitzpatrick, and I have introduced the SSI Savings Penalty Elimination Act, which would adjust the asset limit for supplemental security income. It has gathered support from over 240 organizations, but has not yet been considered by our committee. Let me ask, how would it help seniors, people with disabilities, and children if we were to enact this legislation?
Thank you for the question. It would make an extraordinary difference. It can be really hard to navigate SSI, and for people who are trying to save money and also do all the things of life, you know, you have to pay for car repairs, you have to pay for home repairs. There are all these different things that seniors and people with disabilities need to do. In most cases, we tell people to save, and in this case, we're telling people to be careful about savings. And that doesn't really make sense because it not only leads to overpayments when people are then not eligible for benefits because they went slightly over this asset limit, but it also creates a lot of work for SSA because then they have to keep track of these kind of monthly changes to people's income. And so if we could get rid of that and allow people to save the money that they need and then also take off of SSA's plate having to watch people so closely for their assets to make sure it's not going over $2,000 per month, it would make a huge difference.
Thanks to the chaotic Trump tariffs and his slash-and-burn approach to federal investments, job seekers are facing the worst job market that we've seen in years. Employers have already announced over 800,000 job cuts, the highest level since the pandemic, and the one hiring bright spot, healthcare, is about to be devastated when 15 million Americans will lose their health insurance, according to the big, beautiful bill, and can no longer pay for care. Will this difficult job market make it more difficult for workers with disabilities to find and keep work? And might employers be less likely to begin or continue programs like the ones we've heard about today if there are fewer job openings at a much higher cost of doing business?
So I think these cuts to Medicaid are going to be really devastating because it means millions of seniors and people with disabilities are going to lose access to health care. That means people who are not able to get the help and care they need, people who are sicker. If you're not healthy, it's not easy to work and especially maintain a job. And so we're going to see, even if people want to work, they're losing access to the supports that they need to do that. And you're also going to see people losing access through Medicaid to things like home and community-based services, which allow them to stay in their community to get the care they need and not be forced into institutional care, which will also affect their ability to work and to be able to live and stay in their communities.
Even with that, I understand that the Social Security Administration has announced that it is considering revoking a policy that ensures that seniors and people with disabilities who live with family members who rely on SNAP to buy food can qualify for SSI benefits. How would that policy change affect the most vulnerable and poorest people in our society?
Yes, so this is the Public Assistance Household Rule, and it exists so that people who are in very low income households won't see their benefits reduced because of regulations around what is called in-kind support and maintenance. Typically, people who live in a household with non-SSI recipients will see their benefits reduced by a third because the idea is that they have help and they have support and so they don't need as much in benefits. But when you're in a very low-income household, you do need those benefits and they are critical to your family's survival. And so we have been using, under current rules, SNAP to show that a household is a public assistance household and needs all of the SSI benefits. But with the current changes, this may lead to hundreds of thousands of people. If we change these rules, take SNAP out of the public assistance household category, we could lose that, and hundreds of thousands of people could see their benefits reduced.
Thank you very much, Mr. Chairman. I yield back.